Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, we're going to be talking about general dentist and specialist communications. Now, this topic, I want to give credit to the folks who provided me with this idea. Dr. Nick Gordon and Dr. Lisa Schoaf. Dr. Gordon is a pediatric dentist outside of Washington, D.C., and Dr. Schoaf is a periodontist or gum specialist near Frederick, Maryland. And so they brought it up that sometimes communication from general dentist to specialist is maybe lacking. It's not all that comprehensive, not all that clear. And so they kind of brought up what they would like to see as far as communication is concerned. Because sometimes a patient just wanders in from their offices or from a general dentist's office, but with zero guidance. And the patient would just say, well, I was sent here by the specialist. I'm sure you can figure out what I need. Well, that's not good enough. I mean, let's face it, that's not clear. That doesn't help the specialist. The specialist now has to kind of look at the whole mouth and then guess if something isn't strikingly obvious, guess where the problem is, and then go from there. And that's kind of a time waster. So rather than that, what I encourage people to do, of course, is to utilize pads that are given by the specialist, like this one from Dr. Chrisman, which is very comprehensive. You can lay out the information, and that's very, very helpful. So those, Dr. Chrisman being a periodontist gum specialist that we refer to here in our area, Lancaster, Pennsylvania, great guy, or perhaps write the information on a card, referral card from, say, in this case, Dr. Kaczynski, our root canal specialist, who I've been working with for 14 years, who does a fantastic job, sensational. So you can write information in many different ways. I choose to write out the information, specify the tooth number that might be in question, and ask her to go ahead and treat as appropriate and necessary. And so that's how I approach it. I try to provide the specialist with the quadrant or tooth numbers or number in question, and what could be going on and what hopefully could be done. Now, again, that becomes a question of the specialist then doing his or her own personal diagnostic tests and everything else to determine, yes, this is exactly what we need to do, or hey, time out, there might be something else going on. Explain everything to the patient from their perspective, and then let the patient choose what he or she wants to do. So that is how communication should work. Now, from these two, both Dr. Chrisman and Dr. Kaczynski, I received back amazing letters filled with information. They thoroughly detail everything that was done, discussed, everything else, and then the course of action that was taken from there. So that is how communication should flow. Sure, there are some specialists who may not communicate as effectively or well or as frequently, but ideally that I'm giving you how the information should go from one side, kind of like a tennis match, from one side and then back to the other. So that is it. Hopefully this was helpful for you. And again, I do want to especially impress upon dental students or hygiene students or anybody else that happens to communicate with dentists or specialists. Always, be polite, ask very kindly. I always write please, I always do. So please and thank you. And make sure you specify the areas and what it is that you want to find out or want possibly treated, depending on what the patient wants to do. So make sure you all do that. So dental students, dental hygiene students, anybody else young practitioners, anybody else involved, just make sure you're thorough in your communications. And thank you again for joining me. Hope you're all staying well and healthy.